Hello, my name is Caitlin Rentschler, and today we are going to be talking about the drug GHB. Let's get started. So what is GHB? Well, GHB is a name that's short for gamma hydroxybutyrate. It's also called liquid ecstasy. Chemically, it's called C4H8O3. And it's a type of CNS, which is a central nervous system drug. These can cause drowsiness and are often used to induce sleep for those with insomnia or other such conditions. It does this by stimulating a chemical in our brains called GABA, which slows or prevents brain activity. We should ask ourselves which category of drug does GHB fall under. We already discussed that GHB is a type of CNS, but it's also considered to be a club drug. Other club drugs include MDMA, which is nicknamed ecstasy, GBL, nicknamed blue nitro, BD, nicknamed serenity, Rofinol, nicknamed roofies, and ketamine, nicknamed special K or super acid. Out of all of the drugs I mentioned in the previous slide, GBL is the most similarly linked to GHB, and some may even consider them interchangeable. And they're closely linked when considering one variable. GBL actually becomes GHB once it enters one's body through consumption or other methods. However, if you take GHB, it remains GHB after entering the body. It doesn't convert into GBL. A smaller dosage of GBL has the same effect as a normal dosage of GHB. So this means that GBL is quicker than GHB. And this fact is actually quite dangerous. If one is unaware of the fast onset of GBL, they may overdose. GHB is a dangerous drug, which means it comes with a plethora of short-term issues. According to drugs.com, some short-term effects of GHB are sweating, loss of consciousness, nausea, auditory and visual hallucinations, headaches, vomiting, exhaustion, sluggishness, amnesia, confusion, clumsiness, and there are many more, but those are just to name a few. GHB comes with a lot of long-term issues if you continually take it. First of all, one of these issues is addiction. Of course, we know that addiction is when we use something multiple times and our brain can no longer function without it. Associated with GHB addictions are withdrawal symptoms, which may include insomnia, anxiety, tremors, and sweating, or in some cases, even death. There's also the dangers of overdose. And GHB can cause many problems, but the problem with the most finality is death. And it's especially easy to overdose on GHB if you are using drugs and alcohol with your GHB use. The next long-term issue is the cognitive abilities. Some people might find themselves having problems concentrating, problems problem solving, or making new memories when they use a lot of GHB. There are also psychiatric issues. As mentioned before, anxiety is common, but so are other forms of mental distress. In some cases, they may lead to suicide. There are the respiratory issues. GHB can cause respiratory depression, which makes an individual more likely to contract anoxic brain injury, respiratory infections, and chronic lung disease. There are also cardiovascular issues. After repeated GHB withdrawal, one may experience increased heart rate and a higher risk for heart attack or stroke. And finally, there are the neurological issues. Repeated GHB withdrawal can also cause anxiety, agitation, delirium, and seizures. And these seizures can be fatal. Can GHB be good to use ever? GHB can only be beneficially used under closely monitored medical care by professionals. For conditions such as narcolepsy and insomnia, And for these two conditions, it's used as an anesthetic. It's also used for clinical depression, but only used in some cases of depression. It's also used for alcoholism, and it's used to transition out of an alcohol addiction. So yes, definitely don't ever think about using this stuff without a doctor's care, and don't expect for a doctor to prescribe it to you, because the action of doing that is in fact rare. We already discussed how GHB can be positively used in some cases, but sadly, more often than not, it's abused. One of the ways it's abused is as a growth enhancer. This drug has become popularized among many bodybuilders for its ability to elevate human hormone growth, so that's why it's used as a growth enhancer. It's also used in the club primarily for highs. It's People in clubs usually consider it a safer alternative to ecstasy in the clubbing, rave, or party environment. And next, which I think is the most sad use of GHB, is date rape. Date rape drugs temporarily inhibit the victim's movement and make them unconscious or facilitate a loss of memory, allowing the predator to sexually assault or rape them. This is done by slipping the date rape drug into the victim's drink, usually. This is especially dangerous because if GHB is mixed with other central nervous system depressants, such as alcohol, it can become deadly very quickly. Now, if you get nothing else from this presentation, please just remember what you as a future educator should be aware of regarding this drug. First of all, education is a great prevention method. Talk to your students about how the drug is used for date rape, how its mixture with alcohol is deadly, and how its effects can be chronic or at the least disturbing. Let them know that drug treatment options do exist, such as support groups, and encourage them to use them if you ever find your student using GHB. But it is also important to get to the bottom of why a student is repeatedly using their drug. Are they trying to escape something? Care for the person, not just the addiction. This being said, we should be building relationships with students. This leads them to trust you as a resource. Students are more likely to go to educators for support if they have a pre-existing good relationship with their educator. Make sure students understand that you care and love them. That is the most important commitment I think we have as Christian educators. Voila, welcome to the end of my slideshow. Thank you for listening, and I just hope that you can be able to pass some of this information on to your future students. Also, here's a list of my references. Have a good day.